What is oppositional defiant disorder? That's what I'm talking about today. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today's topic is based on a viewer question from Sarah. Dr. Marks, will you explain what oppositional defiant disorder is? My 8-year-old son was just diagnosed with it. We had to take him out of school because he would scream at the teacher and throw things in class. He doesn't do that at home, but we also work hard to keep him calm because he has a lot of anxiety. I feel like we have to do something before he turns into a monster. I'm really scared. Any information would be helpful. Thanks. Thank you, Sarah, for your question. I hear you, and you're not alone with being afraid of how your child will turn out. Many parents who have a child with oppositional defiant disorder, or ODD, suffer in silence, often blaming themselves for not doing enough or not parenting right. ODD is an impulse control behavior problem that starts in childhood, usually in the preschool years, like ages 4 to 5, and rarely appears for the first time in adolescence, which is generally thought to be around ages 12 and up. So this isn't something that shows up for the very first time in high school or college. Some children grow out of it in early adult years, but if it was present in childhood, it can persist past the 20s. Here is how it's defined by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision. The symptoms fall into 3 categories: angry or irritable mood, argumentative or defiant behavior, and vindictiveness. And you need to have a pattern of exhibiting at least 4 symptoms from any of the categories, and the behaviors need to last at least 6 months. Also, you behave this way when interacting with someone who is not a sibling. You can do this with a sibling, but it needs to happen with other people too. So let's take a look. First, there's angry or irritable mood, and there's 3 symptoms that fall under this category: often losing your temper, being touchy or easily annoyed, like people have to walk on eggshells around you, and you're often angry or resentful. And this is different from losing your temper. This is brooding and ruminating over negative things a lot. Next is argumentative or defiant behavior. You often argue with authority figures. In children, this would be arguing with any adult, and adults argue with supervisors, store managers, or anyone in charge. It's like people in charge trigger you to want to challenge them. Another behavior in this category is defying the rules or refusing to comply with authority figures. Number 3 is you like to intentionally annoy people. An example of this for an adult is wearing really loud cologne to work, or talking loudly on your phone in a small room, not because you're singularly focused and just not paying attention to what's around you. You know your loud talking is bothering people and you get a kick out of it. And last in this category is you blame other people for your mistakes. It's like you don't take ownership of your failings. The last category is vindictiveness, and this is being spiteful or vindictive in the past 6 months. Vindictiveness is the need to get revenge. In a child, this could look like taking Johnny's pencil pouch and making him cry because he stepped on your shoe. In your mind, people deserve to be punished even for accidents. So for the diagnosis, you need at least 4 of those things that are done pretty regularly. These aren't one-off things that you've done sometime in your past. This is regular behavior. A mild form of this is acting out on these symptoms only in one setting. It's common for some people to act this way only at home. In public, they're pretty good. No one outside the home knows how angry they get. If you ask the person how they refrain from acting like this with other people, they'll say that other people don't trigger them. It's just their partner or mom that triggers them. And I say mom because it's pretty common for someone with ODD to still be living at home because they can't or won't keep a job. A moderate form of this is acting out in 2 settings. Example settings are home, work, school, and with peers. If you go back to the viewer's question, her son mostly was active in school with this behavior, but it sounds like he's capable of this behavior at home, but maybe he's not doing it because they're treating him very gently to keep him from losing control. A severe form of this is having symptoms that are present in 3 or more settings. And this person is most likely to have a really poor quality of life because they destroy any support that they get. They can't keep people in their corner. There's a high association between ADHD and ODD. And this means that a lot of people with ODD also have ADHD. Also, ODD can progress to conduct disorder in some, but not all children. The main difference between conduct disorder and ODD is conduct disorder involves predominantly breaking rules and disregarding the rights of others. People with conduct disorder aren't necessarily angry or irritable. They can be defiant, but not necessarily argumentative. Children who continue to demonstrate ODD into adulthood can progress to antisocial personality disorder, which I've talked about in detail in this video. But even if they don't become antisocial, their behaviors cause a huge amount of disruption in relationships through conflicts with parents, teachers, supervisors, peers, and romantic partners. Typically, they have trouble keeping jobs and relationships. And these consequences can also lead to higher rates of depression and anxiety. As I mentioned, this is mostly a disorder of childhood and adolescence. We don't know what causes it, but so far, it's believed that it's related to genes, temperament, and some upbringing. I say upbringing cautiously because this is not a result of poor parenting. There is some association between harsh, neglectful parenting and children developing ODD in that it's easier for children in that setting to develop ODD, but that's still not the entire cause. And this is an important point because so many parents will believe that they failed their child. This behavior is so extreme, it's much more than a child having a temper tantrum or mouthing off from time to time. This is a 6-year-old who may be assaulting a teacher or destroying property regularly. Parents can feel afraid of setting limits for fear that their child will do something to harm them or a younger sibling. So what does the 35-year-old person who had ODD as a child and still has some of it as an adult look like? They may seem like someone with a personality disorder who's always angry, entitled, and externalizes blame. They don't see themselves as oppositional. They feel their anger is justified. Also, even though their behavior is offensive to others, they develop a lot of battle scars from all of the conflict. They may have gone to jail, may be addicted to substances, probably have multiple broken relationships. They may have children that they don't have a relationship with. So they're not really happy people. They're living in their consequences. What can be done about this? Some children tone down as they mature. They may have some residual tendency to be quick to be annoyed or push back against authority, but not enough to get in trouble. This could be the person who works for themselves because they don't like having bosses. But there's a lot of people who feel that way without it being a problem for them. For the child who's getting into lots of trouble, the focus of treatment is therapy for the child to teach them how to regulate their emotions. Then there's also training for parents on how to reward and reinforce positive behavior and extinguish negative behaviors. Some children benefit from medication if they are depressed or anxious. Because remember, even though this is very destructive behavior, the child and even the adult doesn't see it as being oppositional. They justify their behavior as a reaction to something. A child who's being defiant can experience it as frustration and upset. They may not understand why people are angry at them. So there can be depression and anxiety that's present underneath the oppositional behavior. In some cases, doctors may prescribe a small dose of an antipsychotic medication like risperidone or aripiprazole to control the impulsive tantrums. That kind of medication would likely come from a child psychiatrist and not the pediatrician or adult psychiatrist. Some adult psychiatrists will treat teens, but typically prescribing for children under age 10 is best handled by a psychiatrist who has additional training in child psychiatry. Then what about the adult? Well, usually the adult with oppositional defiant disorder isn't seeking treatment because they don't conceptualize their problems as being oppositional. If they come to treatment on their own, it's because of different issues like depression, anxiety, or even ADHD. It's only after getting more information about their relationship history or childhood history that the oppositional issues become apparent. Those issues could still be addressed in therapy if the person is motivated to change. Oppositional defiant disorder can be a precursor to antisocial personality disorder, and for more on that disorder, watch this video. Thanks for watching. See you next time.